The COVID-19 viral disease, which has swept some 121 countries, was on Wednesday declared as a pandemic by the World Health Organization. It is now trending with a mortality rate of 3.4%, with 4,389 deaths globally. While the virus is being dubbed as a global health threat, thousands have recovered from the disease. The virus has also affected several countries within the Caribbean. Jamaica on Tuesday confirmed its first case of imported coronavirus after a female who traveled from the United Kingdom tested positive for the virus. Countries closer to Guyana, such as Brazil and French Guiana, have also confirmed such cases. Meanwhile, locally, the Ministry of Public Health is intensifying measures to ensure there is rapid and effective identification, diagnosis, and management of such cases. At the first COVID-19 symposium held on Wednesday at the National Cultural Center, Deputy Chief Medical Officer Dr. Karen Boyle noted that while there is now heightened medical capacity at the ports of entry, efforts are streamlined to have more medics on board. The ministry has begun recruiting retired medical practitioners to afford such.
We have deployed 8 additional medics to our ports. This is in our effort to shore up. I still think we need to have additional persons available. We need a pool from which we can take persons when we have shortages of staff. The reality is sometimes persons may fall sick or not turn up for work. The supervisor needs to be in a position to take somebody from a pool to say, okay, we have nobody at this port now, we need someone to cover this particular shift.
She pointed out that while Guyana has a necessary laboratory facility to test for the virus, testing kits are limited, supply and sourcing an urgent stock has posed a problem. All persons, regardless of nationality, who within the last 6 weeks traveled to a high-risk area and entered Guyana were screened at the official ports of entry. While information regarding an individual's travel history solely depends on them being honest to the port health official, the Deputy Chief Medical Officer highlighted that the ministry is looking to incorporate laser thermometers into the screening process.
We're in the process of procuring the laser thermometers so we can, at random, screen persons coming off of flights and entering our ports just to see. Because as you recognize, we are dealing with human beings. A lot is depending on people being honest about travel history and signs and symptoms. So it's not negative if we can also have some screening done of passengers who are passing using a laser thermometer just to see if you have cases that are slipping through.
Although there have been conspiracy theories about the origin of coronavirus, it has been confirmed that the outbreak started in Wuhan, the capital of China's Hubei province. The case fatality rate for the virus has declined significantly to 22 persons to date. Meanwhile, devastated countries such as Italy declared lockdown as officials work to contain the spread of the virus. Tamika Rodney reporting for HGP Nightly News.